브리핑이 시작될 예정입니다. 내빈들께서는 자리에 앉아주시기 바랍니다. 네, 지금부터 GHSA 합동 브리핑을 시작하도록 하겠습니다.
Now we are going to begin the press briefing for GHSA. And for this press conference, the official language is in Korean, but simultaneous interpretation is available into English. And to ensure smooth communication, I would like to kindly ask you to take off your facial mask when making comment or making presentation. Now, I'd like to thank all the members of the press and also all the participants. Thank you very much. And my name is Jung Yoo-jin from KDCA. It is indeed a great pleasure for us to have this press conference after the GHSA Ministerial meeting. This press conference is to take stock upon the progresses that we achieved through the GHSA 7th Ministerial meeting and also to talk about the past, present, and future of GHSA. So in this press conference, we have representatives from the host country, Korea, and also the Argentina, member of the steering countries, and former host, Uganda, and also the Thailand, as well as the US representatives are with us today for this press conference. So once again, I would like to thank the members of the delegation for your participation. First, we will hear from the Bang Min-soo, Second Vice Minister of the Ministry of Health and Welfare, and he will be talking about the meaning and significance of GHSA.
Good afternoon. I am Bang Min-soo, Second Vice Minister of Health and Welfare. Journalists from local and foreign media, delegates, thank you very much for joining us at the joint press conference. As we endured the COVID-19 pandemic, health security became more important than ever. During the pandemic, we learned the hard way that no country can achieve health security alone, and that health security threats can only be tackled when the international community takes collective action. And I believe that this is the spirit of the GHSA. Also, we have come to fully understand what and how we need to prepare for future emerging infectious diseases. First and foremost, we must ensure that LMICs strengthen their national capacity to prevent, detect, and respond to future infectious diseases and guarantee not only the rapid development and production of medical supplies, such as vaccines and treatments, but also ensure accessibility and equity. And other than that, we also need PPEs, as simple as masks. And we all experienced the shortage of such supplies. And when the number of patients soared, we realized that ensuring enough capacity in hospitals will be enough as well. Now, sufficient and sustained financial support is required to strengthen health security while promptly sharing information and research on infectious diseases and boosting national health security capacity is also key. And these efforts must be made together by enhancing international cooperation. This integrated partnership is what has been emphasized by the GHSA members since 2014 when the initiative was launched to create a safe and secure world from infectious diseases. Korea has been fully committed to the GHSA as part of the steering group. In 2015, the second ministerial meeting was held in Seoul, giving the initiative the push to take global health security to the next level. Also, after the outbreak of COVID-19, the GHSA has facilitated global access to vaccines while training professionals. At the same time, the GHSA members have been actively engaging in global health security discussions by, for instance, contributing to the establishment of FIF, or Pandemic Fund. The common goal of the international community is to achieve global health security. To meet this goal, the GHSA has enhanced the key capacities to respond to infectious disease outbreaks and swiftly shared the members' experiences in fighting EIDs. As such, the GHSA has served as a platform that facilitates mutual cooperation and assistance. The ministerial meeting shed light on the importance and role of global partnership, brought together delegates who shared their country's efforts and lessons in terms of health security, and suggested a direction for all of us to move forward. Based on our experiences in responding to COVID-19 at both home and abroad, we examined the need to strengthen capacity to respond to EIDs and reaffirmed the importance of sustainable financing for health security, which is in fact a main topic that was discussed in international settings, including the G20. Now it's time to build on what we've achieved and join forces to continue on the success. In today's meeting, GHSA member countries and multi-sectoral delegations unveiled the new Seoul Declaration, which spells out the future vision and goals of the GHSA. Dr. Baek Kyung-nan, Commissioner of KDCA, will give you the details in a minute. Also, as for the role and commitments of the GHSA, especially the GHSA's achievements in the midst of COVID-19, the GHSA's vision and plans for the future, these will be shared by leaders of the 4 countries. Last but not least, as almost 40 countries and 10 international organizations came together to voice the importance of mutual cooperation and solidarity, I am confident that today's meeting will serve as a catalyst for strengthening global health security. As the host country of this ministerial meeting and a member of the steering group, Korea will remain dedicated to the growth of the GHSA in the spirit of solidarity. Once again, thank you delegations and distinguished guests from home and abroad for traveling a long way to Korea. Thank you. Yes, thank you very much. Next, Commissioner of the KDCA will brief you on the new Seoul Declaration. Dr. Baek Kyung-nan will now speak.
Good afternoon. I am Commissioner Baek Kyung-nan of KDCA. Regarding the new Seoul Declaration, let me briefly explain that. I would like to thank all the journalists at home and abroad, as well as members of delegations, for joining us despite your busy schedule. We, the health ministers and multi-sectorial delegations, deeply agree to the need of strengthening health security to respond to COVID pandemic that has lasted for more than 2.5 years and other infectious diseases. For this, we health ministers and the multi-sectorial delegations, following the 2015 Seoul Declaration and 2017 Kampala Declaration, have again reaffirmed our commitment with the new Seoul Declaration 2022. Through the declaration, we agree that the GHSA has played an important role in promoting whole-of-government, whole-of-society approach to national security threat and international security threats posed by public health crisis caused by infectious diseases. And we have built the technical expertise and collaborated through action packages for the prevention, detection, and response to infectious diseases. We also reaffirm the need to continue facilitating the full implementation of the international health regulation for GHSA to lead the national development and support more comprehensive technical efforts in the global health security architecture. Distinguished journalists and members of delegations, Through the new Seoul Declaration, we would like to extend the GHSA for the third phase for the next 5 years from January 1st of the 2024 to December 31st of 2028. During the GHSA third phase, we encourage members to utilize GHSA platform to strengthen global health capacities. In particular, we health ministers and most of the delegation members welcome the proposal of the Republic of Korea, the host country, and one of the GHSA steering group members, to establish the GHSA Coordination Office in Korea to work with other GHSA members to support the efforts to strengthen national, regional, and global health securities. And last but not least, we, the GHSA members, delegations, and Korea, through solidarity and cooperation, we reaffirm our commitment to joining our hands together towards the strengthening capabilities for global health security. Once again, I would like to thank all the delegations who have made great efforts to come up with this declaration. Thank you very much. Thank you very much. Next, we would like to hear from the Sandra Tirado, the Vice Minister from Argentina.
Thank you. I would like first to congratulate the Republic of Korea for hosting this wonderful in-person meeting. For Argentina, and I believe for all members, strengthening national health capacities is one of the key priorities within our public health agendas. Global Health Security Agenda is a multilateral partnership composed of more than 70 countries, international organizations, foundations, and business to strengthen global health security. It's also an important global platform in motivated stakeholders around the world to reinforce countries' capacities to prevent, prepare for, detect, and respond to global health emergencies. GHSA leverages and complements the research of multi-sectoral partners to address priorities and gaps in effort to build and improve country capacities and leadership in the prevention and effective response to infectious disease threats. It is a collaborative initiative bringing together partners to accelerate and optimize global health security. The COVID-19 pandemic has posed a great challenge for the world, especially for the region of the Americas, but it has also represented an opportunity to work together. The pandemic evidenced the relevance of international collaboration and solidarity, demonstrating that GHSA goals established in 2014 are not only still valid, but also need to be continued and updated. Protecting the world against global health emergency is the group vision, which is why we have supported the declaration for extending GHSA in the new phase until 2030. We believe that the continuity of GHSA is one of the tools that will help us to be better prepared for future challenges. Argentina is a GHSE steering group member, whose mandate is to provide strategic guidance and direction, identify overall priorities, and provide leadership and coordination to support the implementation of these priorities, tracking progress and commitments, coordination and communication among partners. Our country is also committed within GHSA to co-chair the Legal Preparedness Action Package, as well as engage in other cooperation activities and groups. We understand that sharing experience, lessons learned, and best practices with regional and international partners is key in order to overcome previous challenges and to be better prepared for the future. Key issues related to pandemic preparedness and response are currently being discussed on the Global Health Agenda, including multilateral forums. The global health architecture in relation to these issues is being reviewed, which presents a critical opportunity for GHSA to engage in this global process, thus supporting WHO's leading role. Therefore, Argentina reaffirms its commitment to GHSA, and we underscore that low and middle-income countries, particularly those in our region, must have a voice in these issues. We encourage and call on other countries to join GHSA to enhance their national capacities and collect work towards the new targets. Thank you very much.
Yes, thank you very much for that, Vice Minister Tirado. Next, from Thailand, we have Director General Taras Krasanaira Wimong, who will now speak. The floor is now yours.
Thank you. Good afternoon. Earlier this morning, I gave some remarks on the achievement and challenge of the GHSA. There is quite a lot that we can highlight and learn from the first and two phases that can reshape how we move forward. First of all, I must mention that one of the GHSA most visible achievement has been the development of the Joint External Evaluation, or JEE. This assessment can help development, can help country to look at where we stand in regard to our ability to prevent, detect, and respond to the health threat. Just a few weeks ago, Thailand completed second JEE version 3. I want to mention this to the country needs prioritizing and investing in our health security system. And JEE is still highly valuable to country before, during, and after COVID-19. Other important achievement of the GHSA during the second phase. In 2021, while Thailand serves as a chair, we had the opportunity to become a front row seat to witness of some GHSA successes. Let me pull a quote from a paper by the Pandemic Action Network Nuclear Threat Initiative. They call the GHSA a coalition of the willing. This is because GHSA serves as a forum for the people who are highly dedicated to building health security capacity, bringing together motivated group of peer-to-peer learning and synergize across sector is a success in and of itself. This has fostered strong coordination. We have seen that have across the technical area of action package as an example of working across action package and sector. I think on Monday we have a joint expert coordination between zoonotic disease and AMR action package. So the other action package also include key stakeholders and enable global healthy security. The results of fruit of our labor can be seen in the work of Task Force on Accountability Resolve, who analyze and share data on the progress toward GHSA 2024 target. This information allows us to reflect upon how better off we are now compared to a world without the GHSA. Finally, something that is not easily measurable but is still an achievement has been the building of the GHSA community. This is not seen purely the number, but very high in quality relationship in our network. So this relationship may come in the form of multi-sectoral cooperation within country or collaboration across border or organization structure. Through the GHSA mechanism, we have seen colleagues and counterparts become friends. Even over the last 3 days that we come here in Seoul, during this rapid change time, we all could benefit from this strong bond for solidarity in our resolve to shape a world safe and secure from infectious disease health threats. Thank you.
네, 감사합니다. 다음으로는 2017년
Yes, thank you very much. Next, we will hear from a representative from the African continent, Dr. Asan Jane Ruth, Minister for Health, will talk about GHSA's achievements so far.
Thank you very much. Jane Ruth Acheng is my name, the Minister of Health from Uganda. And I was requested to talk about the achievements of the Global Health Security Agenda amidst the COVID-19 pandemic and its challenges. And because of time, I will combine the achievements and the challenges. Uganda was one of the founding members of the Global Health Security Agenda in 2014. And since then, Uganda has had its share of outbreaks of emerging and re-emerging public health threats. In addition to the protracted COVID-19 pandemic, Uganda is also responding to an outbreak of the Sudan Ebola virus. Currently, the international community is following the evolution of this outbreak and are on high alert. Leveraging on the experience gained over the years in controlling outbreaks like Ebola, Marburg, the Crimean Congo hemorrhagic fever, yellow fever, Rift Valley fever, and COVID-19, and the investments in infrastructure for a resilient system, Uganda is on track to contain this outbreak with minimal loss of life, disruption of livelihoods, and no exportation of the virus. I want to reassure the international community that this outbreak will be controlled and Uganda remains safe for international visitors and investors. In regards to the achievements, 1, the harmonization of the international health regulation and the Global Health Security Agenda action packages with the resultant joint external evaluation and its revision enabled many countries to assess their capacities. By the time COVID-19 broke out, over 100 countries had been assessed, and we are on track to achieve the targets of the action packages. This capacity was leveraged in response to COVID-19. 2, most of the over 100 countries assessed had developed national action plans for health security, mobilized resources, and were implementing their plans. 3, the Biosafety and Biosecurity Action Package has made the world more alert to the possibility of bioterrorism, as seen by the rapid spread of the SARS-CoV-2 virus and what happened in West Africa with the Ebola virus. This is highly supported by the legal action package, which spells out what needs to be done to control the spread of highly infectious pathogens. 4, the 3 years of COVID-19 opened up to more partners joining the Global Health Security Agenda, e.g. the Private Sector Roundtable, civil society, and philanthropists, hence widening the support base and membership with resultant increase in funding. 5, the existing collaboration between the private sector and academia was quickly leveraged on for research and development of medical countermeasures like vaccines, COVID-19 vaccines, Ebola Zaire vaccines, and now Ebola Sudan vaccines, therapeutics and diagnostics. The same collaboration supported the establishment of the COVAX facility, which facilitated the acquisition and equitable access to COVID-19 vaccines worldwide. To date, the COVAX facility continues to mobilize resources to support the low and middle-income countries. 6, the earlier findings of the JEE and the Global Health Index indicated that the world was not ready to respond to a pandemic in the event that it occurred. This finding was amplified during the COVID-19 pandemic, where over 6 million people died. This lack of readiness was majorly due to limited resources in low and middle-income countries, while in the developed countries, there is a need for reorganization of the existing systems. To address this challenge, the government of Indonesia in 2021 proposed the establishment of a financial intermediary fund, also known as FIF, for epidemic detection, prevention, preparedness, response, and recovery. This dedicated fund is proposed to become operational next year, 2023. 7, the COVID-19 pandemic exposed major limitations in the implementation of the International Health Regulations 2005. This has led to the ongoing revision of the regulations and the development of the pandemic treaty. In this regard, more work needs to be done if countries are to be prepared for the next pandemic. Uganda is ready for the 3rd JEE in 2023 and endorses the extension of the Global Health Security Agenda as has been proposed and endorsed in the Seoul Declaration. I thank you for listening to me.
네, 감사합니다. 마지막으로
Thank you very much. Last but not least, we would like to hear from the U.S., a very important member of the GHSA. So the representative from the U.S. will give us the presentation.
Thank you, everyone. Thank you for having me here today. It's an honor to sit with these distinguished colleagues for this opportunity to speak with all of you. In particular, I also want to make sure that I express my gratitude to the Republic of Korea for hosting us for this very successful and well-organized meeting, for their hospitality, and for bringing us all together on this very important topic. I'd like to begin by noting that the U.S. really does welcome, as was noted earlier, the proposal by the Republic of Korea to establish the Global Health Security Coordinating Office here in Korea to work with other Global Health Security Agenda members to support efforts to strengthen regional and global health security. The office will really play a very important role by improving technical and multi-sectoral coordination. They will facilitate the sharing of best practices and lessons learned among its members and support the technical work of the Global Health Security Agenda action packages, including the next phase of this initiative. As we move into the 3rd phase of the Global Health Security Agenda, we have urged the steering group to develop a plan which contains the following: recommendations to leverage the Global Health Security Agenda network to strengthen subnational, national, regional, and global health security capacities, including technical and multidisciplinary discussions. We would like to see recommendations for the reform of the Global Health Security Initiative's governance, procedures, communication, and working methods. And we've also recommended detailed plans which include new goals and scope for the Global Health Security Agenda, the expectations for member commitments, and a timeline for an external evaluation of the Global Health Security Agenda to be made public in 2026 in consultation with interested members. Recognizing the progress that we have made and the challenges that remain, the United States fully supports the extension of the Global Health Security Agenda for an additional 5-year phase. Looking ahead, a key objective for the Global Health Security Agenda will be to institute key reforms that ensure that it is fit for purpose within the evolving global health security architecture. As the world continues to recover from COVID-19, the Global Health Security Agenda creates a very unique opportunity for countries to come together and realize our collective vision for a world safe and secure from global health threats posed by infectious diseases. We look forward to moving closer to that vision together. Thank you very much.
네, 감사합니다. 이것으로
Thank you very much. So far we have had the presentations or briefings by 6 heads of delegates. Now we would like to open the floor for a Q&A session. Good afternoon. I am the spokesperson of the KDCA. So from now on, we are going to receive questions from journalists at home and abroad. So we are talking about what's next after the COVID pandemic. And so this GHSA meeting has taken place, and together with citizens and also to journal. So now is the time for the Q&A from journalists who have been devoted to overcoming the COVID crisis. But before we have the Q&A session, we would like to give the common question to all the delegates. So for the COVID pandemic that has lasted for the last 3 years, we have gone through a lot of challenges. And what kind of efforts did your country make responding to COVID pandemic? So we would like to hear from the U.S. representative first. And also if other members, if you want to make any comments, please join.
Thank you. So we remain committed in the United States to making sure that we are a good partner to the globe as we continue to learn the lessons from COVID-19 and build on the progress we have made to ensure moving forward that we are all better prepared for future pandemics. For us in the United States, work as it relates to building our infrastructure around surveillance, around data sharing, around multi-sectoral collaboration that we really needed to build in the midst of this pandemic are important efforts that we will look to build on moving forward and welcome the collaboration with our partners across the globe.
네, 감사합니다.
Next, Thailand, Uganda, and Korea. Do you have any additional comments to make? Any comments that you would like to make?
Yes, thank you very much. Uganda remains committed, as has always been, to ensure that we keep the world safe. In that regard, we commit to sharing whatever information we have regarding epidemics, including the COVID-19 pandemic, and sharing whatever new innovations that we discover in Uganda. I thank you.
Next, Thailand. Director General from Thailand.
아르헨티나 차관님.
Argentina.
Okay. Thank you. Thank you for your question. Argentina has made a lot of progress, not only regarding the national vaccine campaign. We have fully vaccinated 80 2% for the Argentine population, but carried out initiative to strengthen the prevention, detection, and response capacity of the health system. Regarding the future plan of Argentina, we could say that the pandemic was an opportunity to rethink our health system. In this regard, we are developing a national strategy that we call towards an integrated health system in Argentina, so that all people, regardless of where they live and their health provider, can access quality and evidence-based healthcare services. Thank you.
네. 다음은 한국의
Next, Korea.
Yeah, thank you. Thank you for the question. I think the GHSA is well positioned to use the data and pool expertise, yes, for the sending across border and sector. Also for the funding mechanism and to set the pandemic fund. And for Thailand, we use the gap identified through AHR or JE to explore what we still have a gap and address that. Also for Thailand, I think we have we have a Communicable Disease Act before the pandemic. But after pandemic, I think we will amend something that cannot counteract with. Also, we can try to speed up for the rapid response team and laboratory system. Thank you.
네. 한국의 차관님.
Korea? Yes, that was a huge question and everybody was so brief. Anyway, thank you very much for the question. Now, let us draw a two-dimensional picture. Now, as we fought COVID-19 in Korea, well, I think that we can come up with 4 values. First, innovation. Second, science and technology. Number 3 is participation. And 4, communication. And here, you have another pillar about our disease control measures. And systematically, we had social, medical, as well as quarantine measures. So as for quarantine measures, well, we did rapid testing for the patients to identify them in the early stage and to isolate them. And that is the role of the healthcare system, and that is the 3T system here in Korea. And prior to the pandemic, well, other than the National Health Institute in Korea, we had many diagnostic institutes that provided the services for that, for diagnostics services. But then now, they were out of capacity because of COVID-19, but now we got ready for that by expanding the capacity. And I'm sure that you remember the drive-through service that we provided in Korea, because in the initial phase, the line was too long, and while waiting in the line, you got infected, and that is why we came up with a drive-through system. And I believe that that was part of our innovative systems. And secondly, about our medical system, we had some ICs, as well as we had some dedicated teams for the patients only. And we also designated a few hospitals, some hospitals, to take care of the COVID patients only. But at the same time, we came up with a community treatment center. So it's not a hospital, but in the community center, you are monitored and you're treated. And I believe that that was another innovative approach that Korea took. And last but not least, about the social response that we took, I'm sure that you all remember whenever you had to go into public facilities, you had to scan your QR code, and that was science-based. And we were able to monitor who got the shots and who got infected or not. And last but not least, I would like to say this because this is a very special in Korea. We have governance. So the Prime Minister and the ministers actually organized a weekly meeting. And 16 governors, including the mayors of the metropolitan cities as well as the major regions, came together for meetings. And they had Zoom meetings. It was a virtual meeting. And in fact, we have a war room within the government, and we actually used the war room for that meeting. It was not actually weekly, it was daily. And everybody participated in the meeting every morning. And about 2,000 accessed the meeting to make comments or to chip in or to listen to others' ideas. And whenever something was off track, then the Prime Minister would correct and would guide them through the next step. So every day we were able to keep track of the number of cases, and we were able to disclose the information in a transparent manner. As a result, well, social distancing was operated very smoothly. So it's too early to assess whether we did well or not. But, well, still, I think that we did good in terms of our quarantine measures, thanks to the communications, innovations, and science and technology. And we are also getting ready for the future. I will talk about 3 points. First and foremost, we have a dedicated hospital for infectious disease. So it is a central center that will take care of the infectious diseases, and the number will be expanded to 6 across Korea. And number 2, of course, science and technology will be key going forward. We have mRNA vaccines in place, and we want to become the production hub. So we want to supply, produce, and be able to develop treatments. And number 3, international cooperation is key. And to that end, GHSA is important. Global Fund, FIF will be some of the initiatives that we will contribute to. And from WHO, we were designated as the bio manpower hub. So whenever needed, we will nurture the right talents. And SK Bio and Samsung Bio Logistics, as you know, they have the capacity to produce vaccines, and we want to make sure that the vaccines that these 2 companies produce are distributed globally, and we want to achieve that going forward, so that we are better prepared for the next pandemic. So I just wanted to tell you that. Thank you very much.
Now, we would like to open the floor for a Q&A. So, journalists, if you have any question, please raise your hand, and we will give you the microphone. And please identify your name and affiliation before asking a question. And also, please designate and mention to whom your question goes to. So, if you have any question, please.
네, 마이크를 좀 가져다 주시고
Can you please deliver the microphone?
Yes, so good afternoon. I am from the Yonhap News, and I would like to ask a question to the Korean government. So the Vice Minister Park talked about how Korea responded to the COVID pandemic based on the science and technology, and also how you manage the social distancing measure. So in the process of COVID, I believe that there were some progresses, and also some of the progresses were pretty unique in Korea. But as the COVID got protracted, there was a sense of fatigue, and also there was a criticism that it was a bit excessive. So in terms of sustainability, I think now we really have to come up with more effective strategies. So what kind of strategy are you going to employ if we are hit by another crisis of the infectious disease in the future? So please briefly describe your future plan. Yes, there was some criticism that the social distancing in Korea was a little bit too excessive. But with the initial outbreak of the COVID-19 in the beginning, we were not knowledgeable about the COVID virus. And so we didn't really know about the details of the COVID virus. So what we did was try to avoid the mutual contact as much as possible. But now we become more clear about the COVID crisis, and so the social distancing has been actually eliminated. If the virus is very fatal, then even if it involves a huge social cost, I think social distancing is a must. But if the fatality is not that high, then maybe we can flexibly adjust the disease response measures and social distancing. So in the future, we actually learn a lot this time, and we have used a lot of IT, but I think they will be more reliant on IT in the future so that we can minimize disruption in people's day-to-day life, but still carrying out disease containment activities. So I think that this should be our future strategy. And if we have to do the social distancing measure in an inevitable manner, then we should provide a sufficient financial compensations for those who bear the brunt. Although we provided the subsidies and also the grant compared to other advanced nations, Korea still falls short of, and therefore we will make sure that they will beef up the financing mechanism as well.
Yes, thank you very much for that answer. Do we have another question? Please raise your hand and ask the question. Do we have a question? Yes, I think the gentleman in the middle, can you please speak up so that everybody can hear you? And then we will move on to you. Yes, hello everyone. I'm from Joseonbis. My name is Lee Byung-chul. So today at the GHSA, you talked about the launch of the coordination office here in Seoul. Do you have any specific schedule for that or timeline? And from Korea's perspective, if this was to be launched, then what role do you think the GHSCO will play going forward, and what support will we be receiving from the office? I think that the commissioner should answer this question. Yes, I will give you the answer. Well, as for the Seoul office, which is under discussion, all the member countries agreed. But as you mentioned, as for the specific role or the specific timeline of the GHSCO, we will need to discuss with the WHO as well as the member countries. Only then we will be able to put some flesh on the bones. And now what we want to achieve with the office is to propose and to coordinate the specific action plans and activities of GHSA so that it can really provide practical support and technical support, as well as human resources support will be another area that the office will assist with, so that Korea, when it comes to global health security, can enhance its capacity.
Next, the journalist on the third row. I'm from Newsys. My name is Kumo-seo, and I have two questions. So you have about 70 member countries in GHSA, and given the need of the international collaboration, I think 70 is not enough. So how are you going to induce the participation from non-members for GHSA? That's my first question. And second question goes to the Minister of Uganda. So maybe not just the Uganda, I would like to ask a question about African countries. So for the vaccine and the therapeutics supply, in fact, the access to vaccine and therapeutics was not really adequate in African countries. So what's the situation? Can you please describe the situations in Africa regarding the supply of the vaccine and also therapeutics? And if you have any messages to deliver to the international community, please do share. Membership is about 70, and maybe the U.S. representative, can you please answer this question, or Korean representative will answer this question? For the membership question.
Thank you. I'll say, and would welcome comments from others as well. we would agree that expansion of the global health security agenda to additional countries is certainly desirable. One of the major lessons we learned in COVID-19 really is that equity needs to be at the fore of what we do as a global community when we are thinking about preparedness for the next, and preparedness and response for the next health emergency. And so the addition of additional countries, their perspectives, their capacities, the ways we can work together, the things that they can bring to the table to really enhance the global conversation around the global health security agenda is critical. And in fact, when I met yesterday with my colleague from Argentina, we discussed expanding the number of countries in Central and South America who would participate in the global health security agenda and how we might work together to do that. So it's definitely something that is on the agenda of the steering group and of countries who really do want to make sure that all boats rise as we continue to work through this agenda and make sure that from an equity perspective we are enhancing the capacity for global health security across the globe.
네. 그러면 한국의 차관님도 한 말씀.
Vice Minister from Korea, are you gonna add?
그 회원국 수
So in terms of the membership, and you said that the membership is not sufficient. And I would like to give you some background as well. So recently, we had a very active discussion on the healthcare issues at the summit. So for example, like the President Biden and the President Yoon Suk-yeol of Korea, they had the COVID-related issue discussion, and based on that, they came up with some declarations. And also I visited this country, Indonesia, Bali, and where there was a G20 health ministerial meeting took place, and we again delved into this topic. And this time, the Seoul meeting actually repeated the discussion that took place last month. But actually, there are a lot of international debates and discussions on health security. So not just the GHSA, we also have a WHO negotiating tables, as well as the Global Fund, and various agendas have been pushed forward. So I would like to mention that there were a lot of discussions regarding the health security. So although if you just think that the GHSA only, you may think that the participation is not that active. But actually, if you look at the overall context and all the discussions that have taken place so far regarding this topic, you'll realize that this partnership and also the interest is very heated. And also recently we held the Bio Summit in Seoul, and so a lot of government officers and also the business sectors took part in. That's why I think that this time the GHSA, there was some overlap. That's why the turnout was not that high. But GHSA, we also have to strengthen the roles of the Secretariat. So if we could have the coordination office here in Korea, I'm sure they will live up to the expectations of other member nations, and also we will be able to have a more organized meeting. Now, from Uganda, could you please answer the second part of the questions? So regarding the shortage of the vaccine and therapeutics in Africa.
Thank you very much for that question. COVID-19 actually exposed some of the challenges that I talked about earlier, that the world was not ready for a pandemic. And when it came, it exposed some of the inequities that exist in the world. And as you correctly observed, in the beginning, vaccines were not readily available to the African countries until towards the end of 2021. To address that issue, there was the creation of the COVAX facility and also bilateral collaborations where vaccines were then channeled to the African countries, although a little late. To date, all African countries have adequate vaccines. I could actually put it at excess vaccines to vaccinate those who need it. However, in preparation for future pandemics, it is extremely important that research and development also takes place in Africa, so that African countries do not only fill and pack, but also develop and produce vaccines in case of pandemics. So your question as to whether we now have vaccines, yes, actually in excess. However, there is a lot of vaccine hesitancy, which is widespread. And that, again, needs to be addressed. I think this is a good forum to begin that discussion with the extension of the Global Health Security Agenda. What will happen when huge quantities of vaccines go to waste? I thank you.
말씀 감사합니다. 시간 관계상
Yes, we will receive one more question. One last question before we wrap up the press conference. Anyone? No? Then I will ask one question before we wrap up. Now, this goes to the Commissioner. Now, to prepare for the next pandemic, what efforts should the GHSA play going forward? Yes, going forward, the GHSA will need to play multifaceted efforts. And the member countries actually gave us much insight on this topic. And to build on that, I would like to say this. Now we need to boost global capacity to better address global infectious diseases. And at the same time, to encourage and to enhance national capacity, GHSA will need to provide substantial support. And going forward, together with international organizations such as the WHO and other NGOs, the GHSA will need to look into how we can better address the specific challenges. And also, as for the therapeutics or vaccines supply, we will need to come up with coordination measures to ensure fair and equitable access to vaccines and treatments, so that all the countries, not just one single country, but all the countries can be safer. Thank you. Yes, thank you very much for that.
So through the press conference, we have had the very good discussions, and we also entertained several questions from the journalists. I would like to thank everyone for your participation, and I sincerely hope that this press conference will give us an opportunity to highlight the importance of solidarity and cooperation to be better prepared for future threats of infectious diseases. So this will conclude the GHSA Ministerial meeting, the 3-day event. For the past 3 days, I would like to thank everyone, so all the members of delegations. Thank you very much for gracing this occasion with your presence. And also I'd like to thank the journalists for your great coverage. And with that, we would like to conclude the GHSA press briefing. Thank you very much.